Hi, my name is Jennifer Wenning. I'm a nurse practitioner at Balance Health, and this is the last video of Heal Your Gut, Heal Your Body, and we'll be looking closer at the SIBO and SIFO protocols. So before you start any of the supplements in this protocol or what was mentioned in the second video, I just wanted to remind everyone, if you have an autoimmune thyroid condition, do not start taking iodine without speaking to your provider. If you have uncontrolled hypertension or taking medications that affect how you clot, you need to talk to one of us first because high doses of omegas can already thin your blood, and then you're kind of adding another blood thinner on top of that. So we want to be very careful with that. Additionally, if you have chronic kidney disease, we want to be careful with eliminating or may need to eliminate magnesium. But the best thing to do is just get your labs drawn before you start this protocol, just so at least we have some baselines so that we know you're not overdoing it. If you are already too high in your magnesium, then obviously we don't want you taking even more. But many people are deficient. That's why it's kind of a recommendation, just standing. And in the fungal overgrowth protocol, essential oils are used, and some of those can interact with prescribed medications. So we want to pay special attention to those. And cloves, cinnamon, oregano, let's see, I want to say there was another one, but those can affect blood thinners and even SSRIs, which is like Zoloft and Prozac, Lexapro, those sort of medications. So let's look at the protocol for SIBO, small intestine bacterial overgrowth. This is the foundation. We've already talked about all these steps in the previous two talks. So removing the grains, especially the wheat, and foods that you're sensitive to, getting rid of the processed foods, the sugars, emulsifying agents, choosing organic foods whenever possible, avoiding or minimizing those over-the-counter medications and antibiotics, replacing those essential nutrients, drinking the clove tea so that you can help build that mucosal layer, staying hydrated because you want to be able to flush out everything that you're getting rid of, and trying to drink the filtered water, limiting carbs to 15 grams net per meal. That is because you don't want to have a whole feast of sugar for the unhealthy guys. We're trying to get rid of them. And if you don't know how to calculate net carbs, you look at the amount of fiber in something. So let's say a carrot had 10 grams of carbs, but it had 8 grams of fiber. So net carbs would be 2. You want to go light on alcohol, and you want to begin your 4-week course with the non-absorbed form of curcumin. And now we're getting into conventional or herbal antibiotics. And not everyone needs to follow these protocols or needs to do them. If you have significant improvements in your health conditions or your GI symptoms of bloating and urgency, whatnot, that from just doing the foundational stuff for the first couple weeks, you may or may not need to dive into this. But let's say you do. So the prescribed antibiotic is rifaximin. You see the dosing there. It's only about 40 to 60% effective in a few studies, and I know one was done by Johns Hopkins. The herbal antibiotics actually were more effective. But the big one is that insurance does not typically cover that rifaximin for SIBO, and it is expensive. I looked it up on GoodRx, about $2,300. So I know if I'm going to spend that, I want to make sure it works. These herbal antibiotics are available over the counter, so you can buy them on Amazon. You can go to the the manufacturer themselves. The first two, the Candibactin, AR and BR, are through Metagenics. And you do have to take both of them. You don't get to just choose one or the other. These do have bactericidal and fungicidal properties. And, much more reasonable cost there than the prescribed medication. Or you can go with the second batch there, the FC-cidal and diazide, and taken as I directed there. Also more cost effective. That's the one I chose to do, and I took that for 2 weeks. And me personally, I still felt like I had symptoms after 2 weeks, but you could do the SIBO yogurt to start with, or you could add it on afterwards like I did. I tried the herbal antibiotic. I had some improvement, but I felt like there was still ground to be had, so I made the yogurt. And these are the strains that are recommended in the Super Gut book. He gives you exactly what brand he recommends. And these are strains that can take up residence in the upper GI tract, and then they compete with the unhealthy guys. So you eat half a cup a day for 4 weeks. In my half a cup, I mix in either inulin powder or FOS powder, because I'm trying to give those probiotics in the yogurt something to eat once they're down there. So you can add a few blueberries, cocoa powder. That's not necessarily a prebiotic, but it just tastes good. So you'd eat half a cup a day, and that's it. So additional supplements during the stage, that curcumin, like I already mentioned, the NAC or NAC, that disrupts the biofilm that the microbes creates because they're trying to protect themselves. So this supplement breaks those biofilms down so that the antibiotics and yogurts are more effective. You only want to take the NAC while doing the protocols. The Dr. Davis doesn't recommend it long term because it can eventually eat up the mucosal barrier if you're taking it too much. And I know some patients that have come to me have been on this for quite a while, so I usually tell them to stop it, or at least pulse it so you're not taking it all the time. Maybe you take it for a couple of weeks and then stop for a couple of weeks. And dosing is there. And this is that air device, is initially made for those people who have irritable bowel syndrome and are trying to follow a low FODMAP diet. FODMAPs are basically different types of sugars, found in berries and potatoes and dairy, all kinds of things. And so when you use this device, I don't really look at the recommendations they tell me, because if I eat an apple and I blow a high hydrogen 30 minutes later, it's going to tell me to stop eating apples. It doesn't get at the root cause. It just is basically helping you eliminate your symptoms. So we use this device for these protocols a little bit differently. And you're trying to figure out just how high up those microbes are. So before starting any of the protocols, I would recommend, if you have one of these, that you start using it 5 to 7 days beforehand so you can get a good idea of what your hydrogen levels are and methane levels are in response to different foods. So when you are using this device, follow the instructions, right? And it's pretty user-friendly, easy app to use. And you want to, for especially your first couple readings, you want to stop eating foods with prebiotic fibers about 12 hours before you start or do your first breath. And so there's the foods there. So what can you eat? You can eat leafy greens, broccoli, different meat proteins if you're into that. Things that just won't set off basically your GI symptoms. So you want to avoid those foods 12 hours prior to the breath testing. And the next morning you do a baseline breath test before you eat. And then you're going to eat purposely some prebiotic fiber. So you might have some inulin powder in your coffee, or half a cup of beans, or maybe an apple, and then you're going to start. And you can also have like eggs or some other protein, that won't cause you to have increased hydrogen levels. It may affect your methane levels though. So then you're going to test every 30 to 45 minutes for up to 3 hours as soon as you get a positive reading. So a positive reading is either a 4 to a 6, or it's 4 units above your baseline. So if you started at a 2 before you ate and then you went up to a 6, that is considered a positive result. And if this is within 90 minutes, then that suggests that SIBO is present. If it's 90 to 180 minutes after you eat, that it takes that long to get a positive, then it's not definitive for SIBO. And if you maybe partially because you have just really fast motility, so things have already kind of moved out. So it could be a false, negative, I guess, if you don't have a positive before then. If you have a high fungal count in your gut, it actually can kind of suppress hydrogen levels, so it's kind of hiding. So it's not a definitive if you're positive 90 to 180 minutes later. But if you have a lot of the symptoms, I would just go based on your gut and follow the protocols anyway. And then the methane and hydrogen sulfide readings, there's not a ton of research on them yet. It suggests that there's unhealthy microbes high up in the digestive tract, but we don't quite know what they mean yet. If you are testing during your SIBO protocol, like while you're actually taking their bowel antibiotics or the yogurt, you're probably going to get a positive. You're going to be lowering high hydrogen and methane because the species, they're dying off. So that's just part of the byproduct. The best time to test post-protocol is a few days after, if you're doing the herbal antibiotic or prescription, or 2 weeks after finishing the SIBO yogurt. And you want to make sure that you're not taking L-reuteri, because that one tends to stay up in our upper GI tracts a lot longer, and it can create a false positive. So, and if you are, if you get the device, you're testing a lot lower, then that's great. That means you're having success, and you want to keep up your foundational recommendations and adding some multi-species probiotics just to keep things healthy. But if you're still symptomatic and you're blowing high levels of hydrogen or methane, then you can extend your herbal antibiotic. You can extend or start the SIBO yogurt like I did. And I already talked about the L-reuteri. And if you do stop the L-reuteri and, your levels improved, after that 2 weeks, I would restart it because there's just so many good things that L-reuteri does for us. So now we're going to talk about the SIFO protocol. This is the fungal overgrowth. And we go low and slow with this one because this tends to be the harder one for people. And you want to build up to 3 oils at a time because you're trying to reduce the fungi's ability to develop a resistance to what you are doing. If we can always do stool tests to test for fungus in the stool, but I don't think it's necessary. And while you're doing the SIBO protocol, it's still good to think about what herbs and spices and whatever you can add to your cooking, because you want to address the fungus while you are doing the SIBO protocol. But this is kind of going even deeper. So what herbs should you be using? Cloves, oregano, thyme, cinnamon, cumin, rosemary, coriander, and peppermint. So you're going to continue the non-absorbable curcumin, or you can add in berberine. I'm about out of turmeric, so I'm going to start the berberine instead, because this can increase the populations of a bacteria called Akkermansia, and it's really great for your intestinal barrier. It produces butyrate and decreases bacterial intoxemia. It has antibiotic effects, just like curcumin. It doesn't absorb well, and it can help decrease your blood sugar levels and inflammation. So it's a good option. We actually do sell this at Balance Health through Zymogen. So when we are doing the oils, you want to introduce one at a time, and you always want to make sure it is diluted with at least a tablespoon of olive oil, avocado oil, or coconut oil. Do not use vegetable oil or canola, any of those. No seed oils, because those are full of omega-6s and very inflammatory. So you start with one oil a day, 1 or 2 drops. If it's been 3 or 4 days and you're doing well, you can build up to 5 to 6 drops of that. Still doing well, then you want to add in another oil. So you see the oregano, cinnamon, clove, or peppermint there. You want to do this for at least 4 weeks or until the signs of fungal overgrowth have receded. So you'll see the rashes, anxiety, malaise, low-grade fever, fatigue. You could also take during this S. boulardii. I'm probably saying that very wrong. It's actually a fungal species that helps keep pathogenic species down. It competes with Candida, and it doesn't take up residence in your GI tract. So if you stop taking it, it's gone within a day or two. So it's one species that I probably will be taking just ongoing, until I forget at some point or forget to buy it. The Lactobacillus rhamnosus is the GG strain is another one that can help suppress Candida. So I would definitely be taking those. But let's talk quickly about reactions. I won't even try to say this, but this is a reaction described by 2 European doctors when they were treating people with syphilis, and they had some fever, chills, racing heart, emotional distress, even progressed to shock for some people. SIBO and SIFO, we are killing off microbes as well, but it's not as significant as syphilis, so we're going to have less severe of a die-off reaction. And die-off is simply a form of endotoxemia. So it's when those the breakdown products of the bacteria and the fungi get into the bloodstream, and that's when you get the rashes and maybe kind of grumpy and don't feel great. But if you do have these symptoms, reframe your mind and say that it's good. It's a sign that you are getting rid of these pathogenic species. So, we can't always feel great when we're treating ourselves for something. So just reframe your mind about it. And, if you do have significant anxiety or dark moods, make sure you tell your provider. That may be a sign that we need to slow down the protocol, which I'll talk about next slide. And just know that it's not forever. You kind of have to tough it out for a few days, and things will get better. So how to prevent this? Take your supplements, drink your green tea with the cloves, continue that neck. Supplement for the biofilm disruption, getting enough prebiotic fibers, because if you don't get enough, some of the bacteria and fungi can actually go into spore forming mode and just proliferate and get even worse. And then they're not affected by antibiotics anymore. So you want to make sure prebiotic fibers are in there. And if you had stopped prebiotic fibers previously because maybe you were just getting too gassy and bloated and uncomfortable, and you stopped them, you'll want to try to reintroduce those. Otherwise, the good guys won't stick around. So, additionally, you can, like I said, you can kind of modify your protocols. We probably always want to be kind of taking something, but you can slow it down. So if you had gotten through the SIBO protocol pretty well, but you start really having a hard time with the SIFO, and maybe you were okay on one oil and you added a second and you're like, oh, not having it. You can reduce the number of drops you're using a day. You could potentially, do like an every other day with that second oil. You just kind of have to listen to your body and play with it. You can also take an activated charcoal that acts basically like a magnet for the debris. They're available like in health food stores. At Balance Health, we have the cell core biotoxin binder that I can order. And then I just learned about this ion gut support. I don't know a whole lot about it yet, but it's something I maybe will look into at some point, because it is specified for gut health. And, if you're kind of wondering, like, well, can it come back? I've done all this. Can SIBO, SIFO come back? Yes, it can. How? Well, if you went back to your old diet, a lot of processed foods and sugar. If you have low stomach acid from maybe medications that you were taking, or like an underlying autoimmune gastritis, H. pylori infections, we can actually do a blood test for gastrin to determine this. Hypothyroidism, if it's not well controlled, because that slows motility of your gut and intestines. If you have poorly controlled diabetes, that means there's more sugar around, so that feeds the pathogenic species. Diabetes also can damage the nerves that go to the intestines, and it stops the motility. So definitely want to keep diabetes in check. If you don't have enough bile or pancreatic enzymes, eliminating grains can help this. We can test for this in stools. If you're on opioids, you're slowing the peristalsis again of your colon. So, and chronic stress, that's a big one. So we need to control our stress. There's some anatomic variants. So maybe you had part of your colon removed for Crohn's disease, or maybe you had a gastric sleeve, or gastric bypass. All of those affect how different parts of your gut communicate. So it can definitely contribute to SIBO and SIFO. And there's an immune system dysfunction due to a genetic defect that you don't produce a certain antibody that is crucial in the function of the mucosal membrane. So we can test for that. If we're not making any headway with any of the protocols, we can dive deeper and try to figure out what's going on. But how do we prevent it? Those foundational recommendations, having a multi-species probiotic supplement after you're done with the SIBO, and rotating every 2 months or so, keeping up with high potency probiotics, especially the L-reuteri. Keep up with the prebiotic fibers, eating fermented foods, and then those herbs and spices, again, keep those in your diet. And here's those resources again in his Facebook group, and it says Dr. William Davis, his Impotent Health Inner Circle. It's just a big crowd source of information, people helping each other manage, the die-off period, or give recipes or recommend supplements that they've had good quality with. So I would recommend joining that, if you're going to become a diehard like me, because they've got just so much information, and I can help to a point, but I'm not going to know everything. No one does. And that's why there's groups like that exist. So anyway, I hope you guys learned something. We are accepting new patients at Balance Health. So I would love to meet with you guys, whether you're patients or interested in learning more about us. So thanks. Have a good day.